Welcome to the Deep Dive. We're here to cut through the noise, get you those essential insights you need. Today, we're diving into something many think of as, purely environmental, but it's actually becoming, and quite rapidly, one of the biggest threats to human health globally: climate change.
Absolutely. And just to give you a sense of the scale we're talking about here, the World Health Organization, the WHO, has this pretty chilling projection. They estimate that between 2030 and 2050, climate change could cause around 250,000 extra deaths each year.
250,000, wow.
Yeah, and that figure, that's just from things like undernutrition, malaria, diarrhea, and heat stress, only those four. And perhaps even more immediate, right now, today, 3.6 billion people are living in areas already highly susceptible to climate impacts.
3.6 billion. That's a staggering number. It really frames what we need to talk about. So our mission today, using these insights straight from the WHO, a really authoritative source on this, is to unpack it. How is climate change directly and indirectly affecting our health? Who's most vulnerable? And, crucially, what needs to be done? We want to give you the core facts, those essential nuggets, without, grounding you in data. Let's get into it.
Yeah, and what's really interesting is how the WHO talks about climate change. They don't just see it as environmental, they actually call it a threat multiplier for health, which when you think about it means it's not just adding new problems, it's actively making existing health challenges worse. It could even undo decades of progress we've made in global health.
A threat multiplier.
Oh, yeah.
That's a really powerful phrase, almost unsettling. Can you maybe paint a picture? How does something like, say, a slightly warmer year multiply threats in ways we might not expect?
Well, okay, think about a heat wave, a prolonged one. It's not just people getting heat stroke, though that's serious enough. It puts immense strain on power grids. Outages happen. That affects hospitals, cooling systems, vaccine storage. Then the heat dries out land, right? Which increases wildfire risk. That smoke causes respiratory problems, sometimes hundreds of miles away. Or you get the opposite extreme rain, floods. Suddenly, drinking water is contaminated, diseases spread. So one climate event, like a heat wave or a storm, sets off this kind of chain reaction. It hits the environment, sure, but also our social fabric, our economies, and critically, our health systems.
Right, it really shows how interconnected everything is, that cascade effect you mentioned.
Yeah.
And you touched on something vital there. These impacts, they hit globally, but, well, they don't hit everyone equally, do they?
No, not at all. That 3.6 billion number we mentioned, that highlights the sheer scale of vulnerability. But there's a massive equity issue baked into this. You have low-income countries, small island developing states, places that contribute very little to the emissions causing the problem, and yet they're facing the absolute harshest health consequences.
How much harsher are we talking?
The data is really quite stark. In regions classified as highly vulnerable, the death rate from extreme weather events, floods, storms, heat waves over the last decade was 15 times higher than in regions with low vulnerability.
15 times. That's hard to even comprehend. What makes those regions so much more susceptible? Is it just infrastructure or?
It's a mix of factors, really. Often, yes, less robust infrastructure plays a big part. Weaker health systems, too. Fewer resources available for, say, early warning systems or adaptation measures. Plus, a larger percentage of the population might depend directly on farming or fishing livelihoods that are incredibly sensitive to climate shifts. So these climate health risks, they land hardest on those already facing disadvantages. We're talking about women, children, ethnic minorities, poor communities, migrants, older people, those with existing health conditions. Climate change just layers more risk onto existing vulnerability.
Okay, so bearing all that vulnerability in mind, let's get down to the specifics. How exactly is climate change impacting our physical health day to day?
Well, the most direct way is through death and illness from these extreme weather events, which are becoming more frequent and intense. Take heat, for example. Recent studies actually attribute about 37% of all heat-related deaths directly to human-induced climate change.
37%. So over a third of those deaths wouldn't have happened without climate change.
That's what the research suggests. And specifically for older people, those over 65 heat-related deaths have jumped by 70% in just the last 2 decades.
70%. That's enormous. And it's not just heat stroke, is it? What else does that kind of heat do, especially to older people?
Good point. Beyond the immediate danger of heat stroke, extreme heat makes existing conditions like heart problems or respiratory illnesses much, much worse. It can interfere with sleep, impact thinking and concentration. It really chips away at overall well-being and independence for older adults.
That's vital context. And beyond the direct heat, what about the absolute basics? food and water.
Oh, definitely. This is a huge area of concern. Right now, globally, 2 billion people don't have access to safe drinking water, and about 600 million get sick from contaminated food each year. Children under 5 are hit hardest. There they account for 30% of deaths from foodborne illness. Climate stresses like droughts and floods just make these risks worse. They contaminate water sources or create conditions where harmful bacteria thrive.
And food security itself.
Yeah, that's critical too. In 2020 alone, around 770 million people were facing hunger, mostly in Africa and Asia. Climate change messes with food in multiple ways, affecting how much food can be grown, its nutritional quality, even the variety available. It pushes already fragile situations towards crisis. In fact, compared to the average from 1981 to 2010, an extra 98 million people faced severe food insecurity in 2020. Climate change played a big role there.
So it's not just worsening existing problems, it's actively creating more food insecurity for millions. Does this disruption also open the door for more infectious diseases?
Absolutely. Changes in temperature, rainfall patterns, they alter the habitats for insects like mosquitoes or ticks. This means diseases they carry, like malaria, dengue fever, Lyme disease can spread to new areas, or the transmission season gets longer in existing areas. The WHO warns that without serious preventative action, deaths from these vector-borne diseases, currently over 700,000 a year, are likely to climb.
And it's not just the physical body taking a hit, right? There's a mental health dimension here too, isn't there?
Yes, very much so. And it's often overlooked. You have the immediate impacts, anxiety, depression, PTSD, following a disaster like a flood or a major wildfire. People lose homes, loved ones. But there are also these longer-term effects. Displacement, losing your livelihood, watching your community change or disappear, that creates chronic stress, uncertainty, and can lead to lasting mental health disorders. The social fabric gets torn.
It's clear the effects are real and widespread. But is it actually easy to put a precise number on the total health impact of climate change? It sounds incredibly complex.
It is challenging, you're right, because so many factors interact, environmental, social, economic. Pinpointing exactly how much climate change contributes to, say, a specific disease outbreak versus other factors isn't always straightforward. However, the science is getting much better. Researchers are developing more sophisticated methods to attribute specific health outcomes, like increases in certain illnesses or deaths during heat waves, directly to the influence of human-caused climate change. So while getting a single all-encompassing number is tough, our understanding of the links and the scale of the risk is definitely growing stronger.
It really sounds like this crisis, this climate crisis, is threatening to just wipe away so much progress. Decades of work in health and poverty reduction.
That's a good way to put it. The WHO explicitly states it threatens to undo the last 50 years of progress in development, global health, and poverty reduction. And it makes achieving things like universal health coverage, the goal of everyone having access to healthcare, much, much harder. It adds to the disease burden while simultaneously damaging infrastructure and making it harder for people to get to services, often right when they need them most after a disaster.
And there must be a huge economic cost tied up in all this as well, beyond the human suffering.
Absolutely. Think about this. Over 930 million people, that's about 12% of everyone on Earth, already spend at least 10% of our household budget just on healthcare. And health emergencies already push about 100 million people into poverty every single year. Climate change just pours fuel on that fire by increasing illness, straining health systems, and damaging livelihoods. The WHO estimates the direct damage cost to health, just the costs of treating illness, building resilient facilities, etc., will be somewhere between 2 and 4 billion US dollars per year by 2030.
2 to 4 billion a year.
And that's a conservative estimate. It doesn't even include the costs in other related sectors like damage to agriculture or water and sanitation systems, which obviously have huge health knock-on effects.
So faced with this scale of challenge, this threat multiplier, what's the bottom line for action? Is there a target, a temperature limit we absolutely need to stay below?
Yes. The global consensus, based on the science, is that we must limit global temperature rise to 1.5 degrees Celsius above pre-industrial levels. That's seen as the threshold to avert the most catastrophic health impacts and prevent millions of climate-related deaths. But, and this is crucial, the WHO is very clear that even 1.5 degrees isn't actually safe.
Not safe. Even if we hit the target, it's still not safe. What does that mean in practice? What are we still facing at 1.5 degrees?
It means even at 1.5, we'll still see more frequent and intense heat waves, leading to more heat stress and deaths than we see now. we'll still see shifts in where diseases like malaria and dengue appear. Food security will still be a major challenge in many vulnerable regions. Mental health impacts will continue. So 1.5 isn't a magic safe number. It's more like the limit to avoid complete systemic breakdown and the absolute worst, most widespread catastrophes. But even below that limit, every single tenth of a degree of additional warming takes a serious toll on people's lives and health. Every fraction matters.
That's sobering. So, given this urgency, this complexity, how is the World Health Organization actually tackling this? What's their strategy?
Well, they've outlined 3 main strategic objectives. It's quite comprehensive. The first one is really about tackling the root cause while promoting health co-benefits. So promoting actions that both reduce emissions and improve health.
Okay, like what kind of actions?
Think supporting a fast, fair transition to clean energy. That cuts air pollution, which has huge immediate health benefits, right? It also means pushing to make sure health is considered in all climate policies, transport, housing, energy, food systems, and mobilizing the health sector itself, doctors, nurses, hospitals, to advocate for climate action and green their own operations.
Right, so tackling emissions through a health lens makes sense. What's the second objective?
The second is focused on our health systems, building climate resilience into them and making them environmentally sustainable. This means making sure hospitals and clinics can actually withstand floods or power outages, integrating climate preparedness into basic primary health care and universal health coverage plans, and importantly, looking at the health sector's own footprint. Hospitals use a lot of energy, generate waste, so helping systems decarbonize, adopt cleaner technologies, become more sustainable themselves.
Okay, resilient and sustainable systems, got it. And the third pillar?
The third is about directly protecting people's health from the climate impacts that are already happening or are now unavoidable. So this involves things like helping countries assess where their populations are most vulnerable, strengthening surveillance systems, tracking heat stress, watching for outbreaks of climate-sensitive diseases like cholera after floods or dengue spreading, and supporting adaptation in those critical related sectors, like ensuring water supplies remain safe and food systems are resilient. Basically, helping communities cope and adapt.
Oh, and a key part of this is also trying to close the funding gap. Health adaptation often gets overlooked in climate finance, so pushing for more resources there.
So mitigation plus health, resilient systems, and direct protection. Seems very thorough. And they do other things too, right? Like raising awareness. Yes, exactly. Those 3 are the core strategic pillars, but WHO also plays a big role in leadership and awareness, trying to make sure health is central at the big climate negotiations, like the COPs, partnering with health professionals globally to get the message out. They're also trying to lead by example, aiming for their own operations to be carbon neutral by 2030. Plus, they focus on providing the evidence, monitoring trends, and offering direct support and capacity building to countries, often through initiatives like ATAC-CH, the Alliance for Transformative Action on Climate and Health.
Okay, so stepping back from all the detail, this deep dive really underscores just how massive the health implications of climate change are. We've gone from those shocking mortality stats to the impacts on food, water, infectious diseases, even our mental well-being, and how it threatens decades of progress, pushing people into poverty. But crucially, there's also this clear message. Taking climate action isn't just for the environment. It directly translates into huge gains for human health.
Precisely. Acting on climate is acting on health. The two are fundamentally intertwined now.
So as you're listening to this, here's something to think about, building on everything we've discussed and that stark WHO response. Given that 3.6 billion people are already living in highly susceptible areas, what's one concrete action drawing from those WHO objectives maybe that can be taken where you live? Whether it's the individual level in your community or advocating for policy, what's one step, big or small, that could help address health vulnerabilities to climate change right there, helping build a healthier, more resilient future for everyone?